Now moving on to renal cystic diseases. So renal cysts are very common, and as a sonographer, you'll encounter them frequently in pediatric and adult populations. Approximately 50% of people who are 50 years and older have at least one cyst. The majority of parenchymal cystic lesions are simple epithelial cysts. They have thin walls, are anechoic, they have good through transmission. They can have thin septations and internal debris, about 5% of them. These may require follow-up. The internal debris can be proteinaceous fluid, or it can be internal hemorrhage. Chronically, some can develop calcifications on their walls. There's a few types of cystic kidney diseases. Multicystic dysplastic kidney, autosomal recessive polycystic kidney disease, or adult polycystic kidney disease. Autosomal recessive polycystic kidney disease, or infantile polycystic kidney disease. Autosomal dominant polycystic kidney disease, or adult kidney disease. Easy to remember that one, ADPKD, so adult. Medullary cystic kidney disease. Cyst associated with systemic diseases like von Hippel-Lindau syndrome and tuberous sclerosis. We get a lot of patients with tuberous sclerosis, and a lot of them have cyst and angiomyolipomas. You also have simple cyst, acquired cystic renal disease, medullary sponge kidney, and some tumors that could be cystic. So you have cystic renal cell carcinomas and multilocular cystic nephromas. All right, so a simple cyst is going to have thin walls, anechoic, and good through transmission. Here you have a cyst in the upper pole of the kidney. The internal echoes is a reverberation artifact. All right, so next here we have a case of a complex renal cyst. This is a young man. These cysts may require further follow-up, as he has. They can have thick walls, or thick septations, some internal debris, and they can develop some calcifications. These are good to follow up because some renal tumors, even renal cell carcinoma, can have this appearance. All right, so multicystic dysplastic kidney is a malformation of the kidney during fetal development. There's multiple cysts. There's no functioning renal tissue. In 3 to 12% of patients, they can have contralateral UPJ obstruction, as was seen in that case earlier. It is usually unilateral, and if it's bilateral, that's usually fatal. Here we have a case of a right normal kidney and the left multicystic dysplastic kidney. I have many cases, but I mean, they pretty much look all the same. All right, so autosomal recessive polycystic kidney disease. So for autosomal recessive diseases, you need 2 copies of an abnormal gene must be present from each parent in order for the disease or the trait to develop. So this is in this disease, usually the symptoms begin in infancy, so it's called the infantile version. The kids usually have very large kidneys, hyperechoic kidneys. There's usually a lot of microcysts. Multiple organs are affected. 80% of them, or greater than 80% of them, develop cysts in the liver, and the kidneys get pretty large. They tend to go into renal failure a lot earlier than autosomal dominant polycystic kidney disease. All right, here we have a case. On the right upper corner, you can see the fetal image, 2 enlarged hyperechoic kidneys. The kidneys can get even larger than that. They can get pretty large. And these are some postnatal images. This kidney here is measuring about 13 centimeters. This kidney eventually ended up measuring 16 centimeters. You can see the microcystic appearance of the kidney. They're just echogenic with lots of little cystic spaces throughout. As opposed to autosomal dominant polycystic kidney disease, or ADPKD, so it's easy to remember. Autosomal dominant, adult. Symptoms typically develop later on in life. The kidneys appear normal early on. They can have a few cysts. Anything more than 2 cysts in one kidney, or a cyst in each kidney, is considered polycystic kidneys, but obviously they need genetic workup as well. You can see later on pancreas, liver, and spleen cysts. Later on in the disease, the kidneys also get very, very large. They can get up to 19, 20 centimeters and bigger. Most of the times you can't even measure it, not even with a curved transducer. You might have to do a panoramic or a dual image to get a proper measurement. Here we have, a young male. Both kidneys, one of them has small cyst throughout, and the other one has a couple larger cysts with smaller cysts throughout the parenchyma. These patients, we follow them up every 6 months to every year, and we scan them and we see the progress of their disease. Some of them stay pretty stable, others progress faster. All right, my ultrasound peeps, I really hope you enjoyed this quick one. Feel free to hit the like and subscribe button and also click the notification bell. Thank you.